So we have a pretty bad laceration of the hand, and the laceration went into the thumb, into the crease here. So all this month we're talking about like thumb injuries. We talked about different types of thumb splints and stuff like that. And I just wanted to take a moment to talk about like how to really manually stretch a thumb well, okay? And part of knowing how to manually stretch a thumb well is to really understand the anatomy of the thumb. All right, so the anatomy of the thumb is that we understand that the extensor tendons, especially the long ones, start down in the forearm, cross the wrist and into the thumb. And then you understand that your flexor pollicis longus, right, starts in the forearm, goes past the wrist, and into passes the MP and into the IP to move. And because we understand that part, that you have your extrinsic muscles, that they're long and they pass the wrist, anything having to do with the thumb sits on top of the wrist. Here's your CMC, your MP, and your IP, that you have to have really good control of your wrist in order to be very effective with the thumb. If you're not controlling the wrist, you're not going to get what you need from the thumb, right? So one of the things I like to do is I like to have a person on the mat if possible. If not, I'll do it on the table, and that's fine. But you can see like I'm almost like having like a arm wrestling type of position. So I put my thumb inside between their thumb, and then my fingers are wrapped around, because at all points I can control the thumb. My fingers in between here, between the first metacarpal and the second metacarpal, and I could actually mobilize some tissues, right? I can actually control the wrist. So when you're working with a thumb, you have to just decide what parts are you working on first. So a lot of times we want to make sure that we have CMC space, right? We want to be able to make that L shape. Whatever they're able to do on the other side, that's what you want to be able to do on this side. And one way to do that is to take your thumb and put it in between theirs and just stretch it out. So you see? And every time I work with anyone who's stiff, everyone, I always pay attention to my own hands and my own thumbs, because if I hurt my thumbs, I really can't help other people, right? So if I can squeeze here, not only am I separating, but because I can wrap my hands around the first metacarpal, I can actually go into MP extension. Can you see that? Relax the elbow. I can feel how tense they are. Relax the elbow. So I'm going to squeeze. I'm going to hold the first metacarpal, and with just the thumb crease of my thumb, I'm moving his MP into extension. And I can control that his wrist is in neutral. Now, if I want to get that IP into a little bit more extension, I can use my other hand now and pull that thumb into extension, right? I can also put my thumb on top of his thumb, controlling the first metacarpal, P1, and then I could stretch out P2, right? Now, because of that flexor pollicis longus crosses the wrist, if I put his wrist into flexion, I can actually get more IP extension, right? If I put his wrist into extension and I try to pull it, it's tighter, right? You feel it all the way down your forearm? Yeah. That's going into composite stretches. As soon as you bring that wrist into extension, you're going to feel the tension. You'll feel the tension over here, and they'll feel the tension all the way down the forearm, all right? So this position just allows you to move more. If there isn't that much motion difference in the IP, that means the IP is just tight, the joint itself. So you can work this joint in isolation. Creams are great and everything when they have scars, but what happens is, oh, actually, you know what, get me a 4x4. What happens is you get kind of greasy and then you don't have really good traction, right? So if you just wanted to work on isolated, because see here, this is tight. Let me see your other thumb. His thumb goes into, look at how much joint extension he has. So the fact that he cannot do that, no matter what position his MP or his wrist in, means that he has joint stiffness, right? There's just, I'm using a 4x4 because there's a lot of cream and I can't get traction, right? So this is just gonna allow me to like hold on to it better. So I can hold in this position, then this hand becomes my stabilizing hand, this becomes my movable hand. Just like a splint, you have a stationary hand and movable hand. So does when you're stretching someone out. You can have one stationary hand and one like to stabilize, and one hand that actually does the moving. So now my left hand is going to stabilize, and my right hand. So I'm just stabilizing so that I can stabilize the MP and not have the wrist play a role in it, right? So then I can take this and then I can go and stretch it out. His IP is, his joint is tight. How do you know the joint is tight? The joint is tight no matter is when there's no change in the joint, no matter what position the MP or the wrist is in. That's how you know that is the IP joint tightness, right? You can flex it, you can extend it. If you extend it, you'll get more flexion. So one way to get more flexion and protect your thumb, right, is that you can put your index finger right here at the IP, and then you'll double up your thumbs and you can do a more sustained stretch. So I'm pushing with my index finger and I'm doubling up my thumb, pushing down on the IP so I can get extension. Do you see it? Do you feel it? It feels good? Mm-hmm. Like it's stretching but without pain, right?
No.
Yeah. You feel it tight but not sharp, not painful.
No pain.
Yeah. And then look, you see how I have this? Now if I wrap my pinky, you see my pinky right? If I wrap my pinky around here on the back of his hand, I can control his wrist better. Don't forget, man, your pinky can work for ya. Stretch, stretch, stretch. And then release slowly. How's that? Looser? So let's do it again. So I'm gonna just stretch. When you have control, you can relax your shoulders, you can dance around, control the wrists, right? And really be able to get that. My finger's down here by his MP, so my index finger, long finger is right by his MP, so I can control the metacarpal. I'm controlling P1, the proximal phalanx, and then I'm controlling the distal phalanx, and I'm really putting pressure right here on that IP. Sustained stretching. And then if you have someone who's really painful, when you let go, they can become really painful too. It's a very sharp pain. So what you can do is ask them to pull down. Pull down for me. Pull, 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 pull. And then as they're pulling, you let go slowly, and they'll come out of that prolonged stretch and it will hurt less. It's a really nice technique to use so your patients are less painful and they trust you. You can do joint distraction. You can kind of like move it volarly, right? There's space volarly to move, right? You can do a little bit of rotation because the ligaments allow some rotation, and that allows you to stretch that capsule a little bit, right? Bend down and then up. How's that? A little bit better?
Better.
Yeah, right? So you can follow up the stretching with active, right? What's another thing I did? So another thing I did to open up the thumb, that's sustained stretching. If you have someone with a lot of scarring here, this is very predominant in like people maybe with thumb or lacerations across their palm, flexor tendons, whatever. But this is very common in a distal radius, relax, where that flexor pollicis longus gets trapped and the thumb gets really tight. So one of the best things that you could do, they have to relax, right? And then this is, I'm gonna pull that metacarpal out and I'm gonna stretch everything back, right? So have that wrist into some extension. Here's the metacarpal, P1, P2, and I'm just doing a sustained stretch, right? And all the while I have control of the wrist. I have control of the wrist, right? Here I can hold, putting my index finger to control the hand, and my thumb meets his IP, so I can hold that IP, and I could use this hand to then massage any scar, any muscles, and I have a sustained stretch. So when I did this last time with him, there's a thing, it's called creeping. It's like when your tissues creep, it goes like, right? So when you're moving, it's like that. Sometimes you can have that in somebody who moves in each step, or you can have that happen as an incident where it feels like you're just ripping through the scarring. So that's what happened with him. Due to that long sustained stretching that we did, paired up with some scar massage, there was this kind of like loud noise where it just sounded like you were ripping through something. You're not injuring anybody. They're more scared from the sound than they are from an injury. You are not breaking their bone. It's not possible. You're not rupturing their tendon. It's just not possible, right? So what you'll hear is that it sounds like a ripping. If you can sustain that, don't let it go. You should feel that it gave. And as long as they're not screaming, or you calm them down, stop screaming, Marco. Right? I had that happen. I was stretching someone's forearm. Like this. We were talking shit. We're like la la la, and then the next thing you know, the whole arm just went like, bah, and it had this terrible loud sound, and she totally freaked out. But I was like, just check in. Did it hurt you? Are you more scared than whatever? And sure enough, she went from nothing to like everything. Can they keep that? Not always. So you have to forewarn that. And that happened to several of my thumbs, where you do that sustained stretch and that IP just like goes. The thing is that it's hard to keep it. And you have some release, but in order to keep it, you have to keep stretching, and then you have to isolate block. And then you have to control it with the wrist. Because if the wrist goes into flexion, they'll lose that stretch that you gain for them. And that's normal. That's normal for them to lose it. So relax. So this is a great way. I just put my hands in between, and it's also a great way to get some thinner stretch, thinner crease, right? Stretch, and to open up that hand like that. So I've got my fingers on his MPs and on his thumb. I have control of his wrists, right? Does it hurt?
A little bit.
Yeah. All right. And those are some tips and tricks on moving the thumb. Let me see. Good. Can you touch it across yet? Can you go like a hitchhiker? Yeah. So we still have some work, but always when you're working with a thumb, always watch wrist behavior and movement. Just like when you're working with the fingers, you always have to pay attention to the wrist. If they start going down, you're gonna start losing that ability to extend. If you can only extend here without wrist extension, you really don't have good finger motion and thumb motion. Thank you. Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.